Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine.
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease and HIV specialist and professor of medicine at University of Tennessee Health Science Center in Memphis. So today is a crazy day for me. I am so excited to have someone who I am so honored to get to know. And I am so thankful that he has agreed to, come spend time with us and kind of, talk to our viewers. So I'm going to introduce our guest speaker today, Mr. Galloway. Welcome, Mr. Galloway.
Thank you.
So let me talk to you guys a little bit about him. So Mr. Denford Galloway is the Planning Council Manager for Ryan White program, which is a program that I'm going to talk about. We will talk about a little bit more in details in this show. So he's been living with HIV since December 2003. Wow. And he has participated in numerous community programs and wellness fairs. He is actively involved with the LGBTQ community, and he's a certified substance abuse counselor and a volunteer mental health teacher for National Alliance of Mental Health. Above all this, he is a U.S. Army veteran. Welcome to the show, Mr. Galloway. I am so honored to have you here with us and to actually share your story with our viewers and with the public. This is something that we talk about here in this show. We talk about HIV and the effects it does have in our communities. I'm not just in Memphis, we're talking about other communities here in the United States as well as the entire world. So here, walk me through, you were diagnosed all the way back in 2003. Tell me a little bit more about that. What happened? How did you get to that point?
I got to find out about my HIV diagnosis actually when I was at the doctor's office having the surgery. I did not have no idea actually that I was going to be even tested for HIV. I was having a lymph node surgery at the time, and actually when I went to the recovery after the surgery, that's when the doctor informed me that I had tested positive for HIV, that I had HIV virus in my blood. So at that point in time, I kind of more so went into shock. My ex-wife at the time was with me because she went with me for support.
Wow. So this is something we've talked about on our show, being asymptomatic, like people just finding out, by accident. So you went in for walk-up for your surgery, and then you're told, oh, by the way, you tested positive to HIV. I can't even imagine how shocked, you were. So what happened after that? You had the surgery, or was that postponed? What was the aftermath after your diagnosis?
Yeah. Well, actually, I was finished with the surgery and I was in the recovery room, and that's when he actually told me that I had HIV. And from there, he actually referred me to a private doctor so I can get into care.
Following your diagnosis, when you showed up for your surgery, what next? How did you follow up with your primary care doctor or with your HIV specialist and was put on medication? Can you walk us through that process?
Yes, after I found out that I was HIV positive, and I went to talk to my private doctor, and he prescribed me medications. From there, I was looking to get into support groups and find out a way to live life with HIV. So that was the toughest part, wondering what I had to do, or wondering how I was going to survive living with HIV. It wasn't far removed from it being a death sentence, so that was a big worry for me.
Absolutely. That's the word, because that's something that I feel like it's a problem. Someone that treats, that cares for people with HIV, that death sentence, because I feel like, our public these days, especially our younger ones, people kind of feel like it's a death sentence, and we try to tell them that's not what it is. These days HIV is almost like someone with hypertension or diabetes. You take your medications and you're fine. So I've talked about what we call medication non-compliance, where we literally fight with people. We need you to take your medicine. So how has that been for you? So we're talking about all the way back in 2003. So you've been taking your medication since then, and tell me how that's been going.
Well, I think taking my medication has really saved my life. So I'm taking medication. I started off with 4 pills a day, but now, thank God, I'm only at 1 pill a day, and which is most people that's living with HIV does take 1 pill a day, and that makes it a lot easier than taking 4 pills a day and not knowing how they're going to interact with each other.
Oh, absolutely. I think there's been great advance in medicine in terms of, you remember back in the 80s, right? People had to take like 10 pills, 12, 13 pills every day.
Yes.
And we are now down to 1 pill for most part. Occasionally you can have people that have what we call resistant strains of the infection of HIV that will have to use more than 1 medication. But for the most part, we get people to just, take 1 pill a day. Now, let me ask you, you are an African-American man, and from what I see when, I interact with, with patients, something that stands out to me and kills me as, as a physician, as a provider, as someone of color, is the stigma that's associated with HIV. What do you think? Like, how did you let your, inform your family or friends, because this is, you are so brave, the fact that you're here sharing your stories to be able to help the next person, to help, our kids. So stigmatization that comes with, this infection is something that, kind of derails people from coming for treatment. Can you tell me a little bit more, like your experience with that?
Well, I've experienced quite a bit of stigma with HIV, and it's out there. And it first started with internalized stigma, because persons like myself that live with HIV and others that live with HIV, they really feel like, well, hey, people think negative of people living with HIV. That's why you got a lot of people that do not want to come get tested, do not want to go and actually go to these facilities, these agencies that treat people living with HIV, because they know people, the general public know these places. So no one wants to be stigmatized or labeled someone living with HIV. It hasn't been easy, but we have to normalize. We have to normalize talking about HIV, because if we don't, then people are going to continue to have that stigma that they live with, and which is going to cost them from getting tested, cost them from getting treated.
Absolutely. Like, I am so excited, to hear you say this, because that is actually what this show is about. Part of what we're doing is to educate people. We have to talk about these things. HIV is something that, nobody wants to talk about it. But unfortunately, it is here in our community and everywhere else. And, we can deny it as much as we want, but it is the reality. And just as Mr. Galloway has said, something that, the stigma that comes with this infection is something that derails people from getting tested. And even when people get tested and they're positive, you don't want to, you don't want to pursue that, because you don't want people to know why, because you are afraid of how you're going to be judged, how your family is going to judge you, how the public is going to judge you. So this is just incredible. And thank you for pointing that out. And, coming from someone who has been there, done that kind of thing, it's not, so it kind of hits home. All right. So now let me tell you, let me ask you this. How did you break the news to your family?
Being able to break the news to my family actually has been one of the toughest things for me. And honestly, sometimes it disappoints me that my family has not had a conversation with me about it.
Wow.
They have eventually found out But even to this day, after 22 years, I have a grown daughter that has not once asked me how you deal with it, how you living with it, how you feel about it, or no brothers and sisters. And I do really understand that, because they may feel uncomfortable with having a conversation about HIV, because a lot of people are not educated about HIV, and that's the biggest issue.
Okay. Yeah, yeah, this is really, this really sad to hear, but, this is actually what the truth is. For, as a healthcare provider, for, most part, we rely on our patients, families, support. We, for instance, we encourage families to, come visit their loved ones and, stuff like that. But, it's just sad to hear, like, having to go through this difficult trial or this difficult period alone, without, family support.
It is difficult not having that support, and that's why I work for an organization, Ryan White Program, that offers support for people living with HIV. So that's one of the outlets of being able to go to support groups, being around people that are living with the same issues that you're living with. And yes, even though HIV is no longer a death sentence, if you do not know your status or get tested, it can be a death sentence. So yes, it's great that we have medicine, but you have to first know that you are HIV positive, and that's through getting tested.
Absolutely, that is the most valid point. Here on this show, we talk about know your status. We're always talking about that. So anyway, we're gonna take a quick break, and when we come back, we will continue this conversation with Mr. Galloway. So we'll be right back. Thank you for tuning into Medical Class 901, a show where we discuss the common infections we see in our communities. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist. So remember to tune in to Xfinity, Channel 17 and 1091 on Mondays at 7:30 p.m. So see you then. So welcome again to the show, Mr. Galloway. Thank you so much. This means a lot, being able to share your journey, with our viewers, and to kind of also, let people, see what it's like. It's not a death sentence. You are here. You've dealt with this for 20 plus years, about 22 years or so, and you are doing great, and you look great. And it takes a lot of courage to be able to share this, story, to share your story with the public. So I am so honored again to have you here. We talked about this being a kind of difficult conversation to have with people, but now we're not just talking about adults. Now we're also talking about kids.
Yes. Right now, Memphis is #1 in the nation new HIV case, and it affects our youth the most, from age 14 to age 25. That's school age.
Yes.
So we got to get out and do more outreach, get out to schools and be able to educate our youth about what it takes to not be able to contract HIV. And that's going to come through people like myself, and letting them know how difficult it has been to live with HIV, but yet and still, we got to be able to have a normal conversation. We got to be able to give them all the education they need. Yes, abstinence is a great thing to preach and teach, but we have to be able to be normal, speak normal to them, because one day if we don't teach them, the street's going to teach them. So we got to get into the schools, we got to get into community centers, we got to get into the neighborhoods, we got to talk to them, we got to educate. We do as many outreaches as possible to get out and meet them where they're at. Right now, we try to even use gatekeepers' youth to let them know that's living with HIV, that how hard it has been to actually live with HIV. So that's the way we're going to be able to stop the growth of HIV, especially amongst our youth.
You did mention, the age group from 14 to 25. We're talking about, middle school, high school, yes, and college kids. All right, and that is scary. That is really, really scary. So I feel like we as the adults, we're not doing as much as we should. So I hope that, some of the, methods that you've talked about to kind of disseminate this information is something that people will listen to. And we as parents, I have kids who fall in this same age range, to be able to have these conversations with my kids. And most of them, they want to hear it because, my children, when I say, hey, let's talk about HIV, they're like, oh my God, Mom, I don't want to hear this. And I'm like, yeah, you will, and they're like, oh, nobody wants to hear that. Yes. But we have to push through that barrier and have that conversation. I had the chance of talking with some high schoolers from one of our high schools here in Memphis, and I asked them, if for some reason you were exposed to HIV, what do you think you should do? And they say, oh, we'll go to the doctors and take antibiotics. And it broke my heart, right? Because this is a virus, this is not a bacteria, so there's no way you can take antibiotics for that. But that also portrays the fact that they just don't have the knowledge, right? So, all right, so let's shift gear a little bit more and talk about the medicine. You said when you started back in 2003, you were on 4 pills, but now we're down to just 1 pill a day. As a healthcare provider, again, we talked about non-compliance. Is that something did you have an issue? We're talking about 20 plus years here. Were you always on your medication every day, or did you have a period where you were just like, I'm just tired of taking these medications?
Well, I've never got to a point where I was tired of taking medication, but during the first stage of that HIV diagnosis and having those 4 pills, one of those pills kind of gave me a rash or what have you. So everybody reacts to medication differently. So there's numerous reasons why people living with HIV don't take the medicine or stop taking it, for numerous reasons. Being in someone's house that's not your own and you're trying to hide your medication. Yes. That's another form of the stigma that we worry about, not wanting people to know that we are taking medication, either being at work and not being able to go somewhere privately and consume your medicine. So there's numerous reasons why people living with HIV will stop taking their med, from being sick to being embarrassed to take it.
Absolutely. So so non-compliance is something, again, non-compliance just means when you're not compliant with your medication. If you're taking 1 pill a day or multiple pills a day, for whatever reason. And, it's easy for us to, to just say, hey, somebody is non-compliant, you're not taking your medicines. But one thing you just pointed out is basically what is the underlying reason behind it. So if someone, for instance, is homeless or does not have enough food, you have other social issues to worry about other than taking your HIV medication. So these are all factors that we call it in the medical term like co-founders, that kind of affect compliance. But for us, from the provider standpoint, compliance is so important, because if you start, stop, what happens is that it builds resistance. And then the medicine that was sensitive at first, all of a sudden, even if you're not taking it every day, it's no longer working. So from the healthcare perspective, we tend to push more about people, taking their medicines. But again, all these other issues that you talked about, and, part of it again is the stigma. If you're not able to be open about it and you have to hide your medications, or, you're living somewhere where you're not comfortable, then these are all problems that, that breed to, well, I say failure of treatment. So we're going to take a quick break. When we come back, we're going to talk about the insurance issues, or if somebody that finally find out that you're HIV positive, how do I get my medication? So we'll be right back. Thank you for tuning into Medical Class 901, a show where we discuss the common infections we see in our communities. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist. So remember to tune in to Xfinity Channel 17 and 1091 on Mondays at 7:30 p.m. So see you then. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist. And today has been a special day for me because I have Mr. Galloway here with us. He is someone that has been living with HIV since 2003. So we're talking about 20 plus years, and he's well experienced in this field. He also works with the Ryan White program, which we're going to talk about in a minute. So welcome back again to the show, Mr. Galloway.
Thank you.
So now let me ask how we know that medications, right? ART, antiretroviral therapy, the medications we use for HIV is not something that comes cheap. And so the question would be, for somebody who is uninsured, right? How would they obtain that medicine? So we know that the major insurance companies that we have, Medicare, Medicaid, Cigna, the private insurances, for the most part, they all cover HIV medications as well as the treatment that goes, treatment that goes with this infection. But there's a population that I feel like kind of will be lost in the whole thing. So for somebody that is uninsured, meaning somebody that does not have either federal insurance or private insurance, and is positive and wants to get on medications, then this is something we worry about in the hospital setting. Well, the first thing would be like, oh, we have to get you plugged into the Ryan White program. And so I know that you are active in the Ryan White program and you play a vital role in that organization here in Memphis. Can you please kind of enlighten our audience what this program is in regards to HIV?
Yes, the Ryan White program, which is something that most jurisdictions has, it's a program to help people living with HIV. Actually, Ryan White was a real person that died back in 1990. So after he died, legislation was passed for a federal grant for people that were infected by HIV and AIDS, okay? So basically what happens is once you are diagnosed with HIV and that is confirmed positive, we'll get that person sent to a case manager within the Ryan White system and get them signed up. They do have to qualify financially. There's a requirement, but most people meet that stipulation, that requirement. So once we get them signed up, that would get them in the link to be able to get free medication, free transportation back and forth to their providers. Okay, so there's a numerous things that they'll have access to, from support groups to oral health and things of that nature. So Ryan White program is a great program for people living with HIV that doesn't have insurance.
So let's assume now that somebody shows up in the hospital for something, and just like in your case, and you find out that you're HIV positive. How can they? Is this something you can get plugged in yourself, or it has to be through a healthcare provider? How does that work?
Well, actually, most people, before they contract HIV, doesn't know about the Ryan White program. Whoever actually test that person and that diagnosis come back positive, they will actually have access and resource and provide them with those resources to get them connected to a case manager under the Ryan White program.
Okay. All right. Okay. So let me go back just to kind of reemphasize something we talked about, which is getting tested.
Yes.
Right? And I keep reverting back to your own case because it is a typical case where you had no idea. You had this infection and showed up in the doctor's office for something entirely different, for a surgical procedure. And then they're like, oh, by the way, your HIV, is positive. And so something that we are seeing here, given the fact that this infection, disproportionately affects minority communities. We're talking about the Black communities, the Hispanic communities. I wonder, is it kind of related again to that stigma? Why is this happening? Because you not knowing that you have HIV can easily, like unintentionally, give it to the next person, right? And this person who also has no clue that they have this infection passes it on to the next person. So the emphasis now, even though, we talk about treatments and all that, but I kind of feel like the emphasis now would be more like knowing your status kind of thing.
Yes. The emphasis is put on, especially people of color that actually at higher risk in other communities and contracted HIV, it probably would be geared toward not having insurance in the first place to go back and forth to the doctor and get that education that they need about certain things, sexual health, and which HIV fits up under sexual health.
Yes.
So not being able to go to the doctor because of lack of insurance and other resources that causes them to be at high risk.
So basically, this boils down to social issues, yet again, yeah, it's kind of disheartening, and that's the reason why we're doing this show. Hopefully to reach as many people who may not have the opportunity to speak one-on-one with an infectious disease specialist, or other healthcare providers, have these one-on-one conversations, and you want to hear from someone who cares about it, and I'm so thankful that you are here also as a living example of what this is about. Okay, so let me ask you now, okay, you brought up the fact that, for instance, here in Memphis, we're seeing the younger population getting infected at a very alarming rate. If you had the chance to speak to, these kids, like, what are you gonna say to them?
What I need to say to our youth, you all are our future first and foremost, but we need to be able to know our stats. We need to be able to talk to someone, have conversation with each other, and to a buddy system. But we need everyone to know their stats and get tested and make the right choice and make the right decision. I know you all may see people like myself who live with HIV for a long period of time thrive and do well, but behind the scenes, everybody's not doing well. Even though we have medicine for it, there's some mental issues, there's some emotional issues that's involved with living with HIV. So I'm going to encourage each and last one of you all to get tested, to know your status. If you feel like you got to be sexually active, be safe, stay alive, because you are our future.
I totally agree with that. You all have heard from Mr. Galloway. I agree 100%. So for our young folks out there, even for for the older ones, basically for everyone, know your status. His case is a typical case where you just found out by accident, right? And so even we talked about lack of insurance and the issues that come with that, but something, there's been so much advancement, in HIV compared to what it was back in the 80s or early 90s. Now you can actually walk into Walmart and buy a self-kit, testing kit, where you can test yourself. Or, we have centers around the cities where you can actually go for, private, free testing. You don't need to pay a dime for that, and know your status. So that's something now we're going to encourage people, because you would not know, unless you get tested. Therefore, parents, trust me, being a parent myself with kids, I have a teenager, I have someone, in their 20s in college. It is so hard to have this conversation, but this is something we have to do. So I am encouraging every parent out there, talk with your kids. There are a lot of things kids do that we as parents, do not know. You might not even know that your child is sexually active, or, maybe there are other, social behaviors, that you may not even know about. But being able to have this conversation and just say, hey, listen, there's this infection that's out there. These are the modes of transmission. You can get it from this and from that. We need it to be safe. And we need you to get tested. So if you have a child that is sexually active that you know about, it would be in their best interest also to know their status and to get tested. So this has been an interesting conversation with Mr. Galloway. I am so honored to have him here, and I am just blown away by the fact that he put himself on the spot to have this conversation, to be able to save as many lives as possible. Because if you have HIV and is untreated, it's basically what the death sentence is going to be. But the good news is that we're able to do that. So thank you all for joining us today. Thank you, Mr. Galloway, for joining us today.
Thank you for having me.
Absolutely, my pleasure. And this is Medical Class 901 with Dr. Chi. See you next time.
Thanks for watching the Medical Class 901 with Dr. Chi MD.